Okay, let's dive in. Welcome everyone to a new deep dive.
Glad to be here.
So, picture this scenario. You're an older adult, maybe retired, maybe still working, but you feel good, active, independent, sharp.
Pretty much running your own life.
Exactly. And then, bam, a serious diagnosis hits you, something like cancer.
Yeah.
It's overwhelming, naturally. You're gearing up to fight it, looking at treatments.
Maybe getting second opinions, all that.
Right. And then your doctor says, I recommend you see a geriatrician.
And that's the moment, right? For a lot of people, it just feels off, jarring.
You think, wait, hold on, geriatrician. I'm not frail. My mind's working fine. I handle my own stuff.
I walk a mile every day, or, whatever it is that makes you feel capable. It can feel like they're suddenly seeing you differently. Like maybe they think you can't handle this.
It really can.
Yeah.
Maybe it's a step towards being, I don't know, sidelined, underestimated. But that's what we're unpacking today. We've got this source material that really challenges that initial reaction. We want to dig into why this recommendation gets made and actually uncover the really crucial value in it.
Yeah, what we found is it's not about limiting you at all. It's actually the opposite. It's about enabling you, helping you get the best possible treatment, but safely.
Okay, so the source material tackles that first feeling, that why me, I'm fine feeling.
It does, right up front. It really emphasizes that, look, a geriatric assessment. It isn't just for someone who's visibly struggling or having significant memory issues. It serves a much wider purpose, especially when you're facing something as demanding as cancer treatment.
Got it. So it's absolutely not about saying, oh, you're too old for this or you're too weak.
Definitely not. The source actually uses this great analogy. Think of your oncologist, your cancer doctor, as the driver of the car. They're steering the main treatment plan.
Okay. The driver. Makes sense.
And the geriatric assessment, that's like installing a really sophisticated airbag system in that car.
I like that. So it's not driving. It's not choosing the route or the speed.
Nope. Its job is to do a really thorough check of the whole vehicle, that's your overall health, beyond just the cancer, specifically looking for potential bumps in the road that might pop up during that really intense treatment journey.
Okay.
And then, critically, it helps build in the cushion, the safety measures to protect you, to preserve your strength, your quality of life, so that you can actually complete the journey.
So it's like proactive safety planning, tailored just for you.
Exactly. Custom built. And to make this really clear, the source gives us this fantastic real-world example, a patient they call Eleanor.
Right, Eleanor. Let's talk about her.
Yeah, Eleanor's case is perfect because she really fits that profile of someone who'd likely, question the need for this. She was 79, a retired research chemist.
So sharp lady.
Very sharp, and high-functioning by any standard. Active, walked a mile daily, lived independently with her husband, handled all her own finances, medical stuff, just seemed incredibly capable.
And the source mentioned she had that analytical mind, probably made her even more likely to push back on things that seem, well, unnecessary to her.
Absolutely. So she gets diagnosed with esophageal cancer. And her reaction when she's sent to the geriatrician, the source quotes her directly. With this sharp analytical look, she says, "Doctor, I appreciate the thoroughness, but I need you to know I'm not losing it. Why am I here?"
Wow, that perfectly nails that feeling we were talking about.
It really does.
So, okay, she seems so capable. Why did you need this assessment? What was the benefit for her?
Well, this is key. The source points out that even when someone seems really high functioning on the surface, the cancer itself can be quietly taking a toll.
Even before treatment.
Yes. In Eleanor's case, her esophageal cancer was already causing her significant trouble swallowing. She had a cough, some nausea, and all this was leading to this underlying fatigue. She might not have even fully realized it was the cancer causing it yet.
Okay, so her baseline, her reserves, might have been a bit lower than they looked.
Exactly, and then you add cancer treatment, which by design is intense. It's powerful. And it can interact with these sort of hidden vulnerabilities, things that might not come up in a standard oncology visit that's really focused on the tumor and the treatment drugs.
Right, the oncologist has a specific focus.
The geriatric assessment takes that wider view, that systems level look at the whole person.
Okay, let's really get into the weeds then. What are the key parts of this assessment? Using Eleanor's case, like the source does, what bumps were they looking for, and how did they build that airbag for her? What's first?
First up is what they call competing illnesses. Basically, other significant health conditions someone has alongside the cancer.
Okay.
For Eleanor, it wasn't just being 79 with this cancer. She had a pretty significant history of heart disease, major bypass surgery years ago, and her latest EKG showed a minor electrical irregularity.
And why is her heart history so critical specifically when planning cancer treatment?
Well, because, as the source explains, a lot of standard chemo drugs, and even some of the newer immunotherapies, can be, well, tough on the heart.
Right.
They can add stress, some can even be directly toxic. So if the oncologist is thinking about using one of these drugs, which might be the most effective option for the cancer, you have to know, can her heart handle that extra load safely?
Makes sense. Ignoring it would be like planning a massive road trip without checking the engine oil.
Exactly. It's a perfect analogy. So the assessment flagged this risk. It triggered a consult with a heart specialist before treatment started. And again, it wasn't about saying, oh, she can't have the treatment. It was about making sure her heart was ready for it, making it safe to receive it.
Optimizing her whole system for the treatment. Okay, that clicks. What's another area they looked at?
Nutrition. Super important. Now, Eleanor's weight was stable, but remember, she was already having trouble swallowing because of the tumor itself.
Wow.
And the source points out that treatment for esophageal cancer, whether it's surgery, radiation, chemo, or some combo, is almost certainly going to make that swallowing issue worse, at least for a while.
So they don't wait until she's already losing weight and getting weak.
No, that's the key, the proactive approach. The source really highlights this. Get a nutritionist involved from day one, have an honest talk about strategies, maybe even discussing the possibility of a temporary feeding tube.
Which some people might see as like a sign of failure or giving up.
But that's not how it's framed here at all. The source emphasizes it's presented as a smart, temporary bridge, a tool to preserve muscle mass and strength, to make sure her body has the fuel it needs to actually get through the demanding treatment without getting dangerously depleted.
Okay, proactive nutrition planning makes sense.
Yeah.
So other health issues, nutrition, what about all the other medications someone might be taking?
Ah, yes, polypharmacy. Or really just careful medication review. In Eleanor's case, she was taking diazepam, a long-acting sedative for sleep.
Okay. Seems kind of minor compared to cancer and chemo, maybe. Does changing a sleep aid really move the needle that much?
You'd be surprised. The source points out that this specific type of long-acting sedative can cause a lingering hangover effect, which was likely contributing to Eleanor's daytime fatigue even before treatment fatigue kicked in. Imagine trying to navigate tough chemo side effects when you're already feeling unnecessarily groggy from your sleep med.
Yeah, that would be rough. Stacking difficulties.
Right. So the assessment caught this, and the recommendation was pretty simple. Switch to a much shorter acting medication, taken only if she really needed it. It seems like a small tweak, right?
Yeah.
But it could significantly boost her energy levels, her alertness, and ultimately her ability to tolerate the cancer treatment and maintain a better quality of life during it. It's about removing even those small hurdles.
That really shows how detailed and holistic this is, looking at everything. Any other major areas?
Yep. One more big one they highlight is looking at pre-existing conditions and how this specific planned cancer treatment might affect them. Eleanor already had some peripheral neuropathy.
That tingling or numbness, usually hands and feet.
Exactly. And this was crucial for her because, the source notes, a very common, very effective chemo drug for her type of cancer, paclitaxel, is notorious for making neuropathy worse.
Oh, wow. So if she already had tingling, that drug could really ramp it up.
Precisely. So knowing about her pre-existing neuropathy before starting treatment, that's vital information. It allows for a truly personalized approach.
Oh, so what could they do?
Well, the oncology team and the geriatric team can talk. Maybe they opt for a different chemo drug that's less likely to cause neuropathy if that's a good option for her cancer. Or if paclitaxel is really the best choice, they have a clear plan ready from day one to monitor her closely and manage that side effect aggressively if it starts to appear.
So it's not necessarily about avoiding the best drug.
No, it's about figuring out the safest way for her to get that drug, to complete the whole planned course, without a debilitating side effect like severe neuropathy, forcing her to stop treatment early.
Okay, this is really bringing it together. Let's circle back to that key point, Eleanor's initial, why am I here? I'm not losing it. This whole assessment, it wasn't about judging if she was too old or too frail for the treatment itself.
No, it was the absolute opposite. The source is so clear on this. The entire goal was to gather all this comprehensive info, heart, nutrition, meds, neuropathy, but also her cognitive strengths, her her family support, and use it to make it possible for her to get the best, most effective cancer treatment for her and to get through it safely.
They weren't deciding if she could be treated. They were figuring out how she could be treated successfully.
Yeah.
Building that airbag, like you said.
That's exactly it. The assessment identified those potential vulnerabilities: the heart risk, the swallowing issue, the sedative, the neuropathy risk. And then, importantly, it turned that knowledge into a concrete, actionable plan for her oncologist.
Like, okay, here's what we need to do. Get the heart consult, make sure the nutrition plan is ready, watch for neuropathy.
Precisely. And, just as important, it also highlighted her strengths, her sharp mind, her supportive family. Those were seen as assets, things that would help her tolerate and complete the treatment.
Did Eleanor come around to seeing it that way?
The source says she did. She understood it wasn't a judgment about her age or her abilities. It was actually a very sophisticated approach to honor her entire health story, all the pieces, to give her the best shot at a good outcome.
Which connects right back to you, the listener. If you're ever in this situation, or loved one is, understanding why this detailed assessment is suggested is so important. The source calls it the ultimate form of personalized medicine.
And it really is. It's seeing you as a whole person, your unique history, your strengths, your potential weak spots, not just the disease label, and using all of that information specifically to help keep you safe, strong, and living as well as possible while you go through something as tough as cancer treatment. It's about stacking the odds in your favor.
So, boiling it down, what's the core takeaway from the source material here? If you or someone you care about gets recommended for a geriatric assessment, especially around cancer care,
please try to see it as a really positive sign. It means your medical team is being incredibly thorough, proactive. They're looking at everything because they see you as a candidate for effective treatment, and they want to make absolutely sure you have every support, every safety net in place to tolerate it and get the full benefit.
Yeah, the advice from the source is really clear. Don't shy away from it. Ask for it if it isn't offered, maybe. And if it is offered, embrace it. It's designed to empower you.
Exactly. To optimize your chances of getting through treatment successfully and hopefully thriving afterwards.
And maybe just one final thought, building on all this for you to ponder. This whole approach, this comprehensive, proactive planning that looks at the entire person, their health, their life, not just a diagnosis. How could that model apply more broadly, beyond cancer?
Yeah. What assumptions do we tend to make about aging and about healthcare that this kind of deep dive fundamentally challenges? Something to think about.